In today's video, I am going to talk about the top 10 areas of treatment for neuromodulators like Botox and Dysport. And I'm also going to let you know exactly how many units or a range of units and approximately how much each area should cost. Hi, I'm Becky Wilkins. I've been a registered nurse for over 30 years now. And for the last 25 years, I've been building my business here, External Affairs Medical Spas. Our specialty is aesthetic treatments as well as regenerative medicine. And our goal is to bring you all the latest information on these topics. Please like and subscribe and share our videos, and be sure to put comments down below if you have questions about any procedures. So in today's video, we're going to address all of the different areas that we can use a neuromodulator, such as Botox, Dysport, or Xeomin. We've got our lovely model, Carrie, here today, and we're actually going to be drawing on her and showing you all the different areas that can be treated. One of the biggest questions or concerns that we have is the associated cost to these treatments. So I'm actually going to review exactly how much should be used in each area and give you an approximate cost as to what you should be paying for that. There's some confusion in the industry. Sometimes people are charging less per unit, but then they're putting in twice as many units, and that brings the cost up. So we're actually going to draw, and I'll give you some ranges just to give you a perfect idea. We're going to cover the top 10 areas that we treat with a neuromodulator. So, are you ready, Carrie?
I am.
Okay. So we're going to start with the most popular area. Number one is the Glabella region, which is this area in between the brows. Carrie, I'm going to get you to frown for the camera. Pull together, mean and mad. Good, and relax. So as you can see, it's these two muscles here that pull together. So we want to do an injection in the middle, right here. And we also want to catch this part of the muscle out here. And so in this area, typically doses will range anywhere from 15 units for somebody who's very young and has a very small pull, all the way up to 50 or 60 units for someone with a very strong muscle, or men in particular typically have stronger muscles there. So pull again, Carrie. Wonderful. So for somebody like Carrie, I'm probably going to do about 25 to 30 units. And that will relax this pull beautifully. Now in doing so, this muscle pulls down and in. So when we relax it, we actually get some elevation here. And quite often people will get a little bit of a brow lift just because this muscle will try and work harder. Yeah, so we always want to be creating that brow lift. The number two area we'll move to is the Frontalis region, forehead region. And Carrie, I'm going to get you to raise your eyebrows up really high for me. Good, and relax. And is this an area of concern for you? It is, okay.
Yeah.
So this is really an interesting area because so often women start to get these horizontal lines here. They want them treated, they want them relaxed, but they also want a brow lift. So it's a fine line. Mm-hmm. When we're treating this area, we have to stay high, because what we don't want to do is we don't want to relax the muscle here that allows you to pull up.
Yeah.
Because that will actually do the opposite, it'll actually drop it.
Okay.
And it's very interesting, we have a lot of patients come in and they'll say, can you inject me right here to give me a brow lift? And I always tell them that's the opposite. If I inject you right here, I'm going to give you a brow drop, okay? So when we're injecting, above the brow, we want to keep it definitely very high. Raise up again really high for me. Good, and relax. So I tend to do kind of a zigzagged pattern, just so I can put small amounts evenly across the forehead. So the dose range in here should be between 6 units, all the way up to 20 units if somebody's got a big forehead, or again, a man who's got a lot of lines. So that should cost approximately $60, to $200 for that region. So the number 3 area that we treat is the Obicularis oculi muscle, which is the muscle that runs around the eye here, also known as crow's feet. So I'm just going to turn you a little bit, Carrie, for the camera, and I'm going to get you to close your eyes and squeeze tight, 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 like you're trying to keep sand out. Good, and relax. So she doesn't have a lot of activity here, but I will place a tiny bit, in around the muscle here, because that will prevent those lines from etching in. It will also help elevate and open up her eye this way, because this muscle, it pulls in and down, so if we relax it, we get an opening like that. So she doesn't require a lot. Typically dose ranges for this area might range between 8 units and 20 units per side. Somebody like Carrie doesn't need very much. I'm probably just going to do about 8 or 9 units. So the cost for crow's feet, both sides together, would range between, you know, $160, you know, up to $400 for both sides. So we're going to treat that as well. The next area that we're going to talk about is the bunny lines. Okay, so this is the Nasalis muscle here. So wrinkle up your nose for us, Carrie. Good, and relax. And I'll just turn you a little bit if you can do that again. Great, and relax. So these lines, they don't need to be treated. However, what happens sometimes if people are relaxing the middle here, again, whatever can move will.
Yeah.
So sometimes that nasalis muscle, it starts to compensate and starts to wanting to pull up, and you get these little line formations here. Also, if you're in the sun a lot and you're squeezing and squinting. So usually we just treat the area with 4 to 5 units, 6 units maybe total. So that would be between $40 and $60 for that area. Now we're going to move down a little bit, and we're going to talk about, you don't have this, but we're going to talk about a gummy smile.
Okay.
So when ladies do their smile and that lip really pulls up, okay, exposing not only their teeth but their gum as well, that's from this muscle here. So if you do a big smile, good, and relax. So it's actually this muscle right here that's pulling up, and we usually just place 1 to 2 units per side. So that would be between, you know, $20 and $40 total, and that can pull that lip down. So you want to make sure that the patient's okay with that because it will make the lip feel a little bit heavier. The other area that we're going to talk about is the Obicularis Oris muscle. So if you can give us a little, yeah, good. So a lot of ladies might not be ready necessarily for filler in the lip, but what they're starting to see is these little tiny fine lines with movement or talking. You know, we start to get that little pucker.
Yeah.
The other thing that's happening, of course, is we're losing collagen around, you know, underneath the skin around the mouth. So we start to see those little fine lines up here. I always say the first sign of declining estrogen is lip lines.
Yeah, and I'm starting to get them for
Yeah.
sure.
So it's, you know, maybe at some point we'll do some filler in there, but in the short term, we can actually just place a tiny bit of the neuromodulator around the mouth. So we'll use usually anywhere between 4 and 12 units if somebody's got a really strong pull. That will relax those little lines. It'll also sometimes give a little bit of a flip to the lip. So a lot of gals like that just because it's like it's kind of a quick, easy way to plump up the lip.
Yeah.
Okay, so we can try that on you. That would be fun. The next area that we're going to address is the Mentalis muscle. So right down here. So if you can try and sort of cobblestone your chin where you go, yeah, good, and relax. So Carrie, this isn't a huge issue for Carrie, but we do see a lot of ladies where when they're talking, this is starting to pull up, and it's actually creating a line here. And if you think about the older women that have that little ball, and when they talk, it's just pulling up. So part of the youthful face is keeping this sort of pulled down.
Yeah.
So sometimes we'll just put 3 to 5 units on each side, and that will drop that down. So that would be between $60 and $100 to give that shape there. So that's a fun little spot to do as well. Now I'm going to turn you a little bit like this, and we're going to talk about the jaw. So again, everything that we're trying to achieve is keeping this jawline, you know, that beautiful Fibonacci curve. This muscle here pulls down as we get older. So if you can go like this, Carrie, go, yeah, a little bit. Try sticking out your bottom lip. Good. So there's a muscle that comes off the corner of the mouth here, like this, and it's attached to this band, and it pulls as we get older. So when I see a lady who, when she's talking, this is pulling down, that's actually building this muscle, and it's creating this sort of bump in the jawline, and so we want to relax that. So sometimes we'll either just place a little bit of the neuromodulator here, or sometimes we can actually go along the jaw and down the band, and that's called a Nefertiti lift. So the cost of that would range, you know, typically between 5 units all the way up to 16 units. So anywhere from $100 to $320 to do a Nefertiti lift. But quite often that will smooth that jawline, which people quite like. Earlier we were actually talking about the masseter muscle. So Carrie, I'm going to get you to clench down for me. Good, and relax. She's got her masseter muscle here is rock hard, okay? And a lot of women who, if they're clenching a lot, they're actually building this muscle, which contributes to, you know, in time it makes the jaw more square, which is the opposite of feminine, okay? So quite often we're doing it to relieve the discomfort of the clenching, But if we've got a gal who's developed a very square jaw and she wants to slim,
Yeah.
that we can actually treat the masseter muscles as well. Typically in our clinic, we'll treat anywhere from 15 to 40 units per side.
Okay.
So that might range between 30 all the way up to 800 to really soften that, and it needs to be done 3 times a year to really sort of minimize that. But we have a lot of patients that get a lot of relief from having that done. Now the other areas that are popular for treating with neuromodulators are for hyperhidrosis. So underarms is the most popular. Hands and feet can also be done. And then of course the migraine program, which treats all the way across here, all the way up the back, all the way through here, and through here. And Alberta, of course, is one of the only provinces in Canada where the physician's fee is covered for that, which is fantastic. So those are some of the most popular areas to treat with the neuromodulators. One more area I'll just address is the décolleté. We can actually put tiny little bits all across through here just to soften those lines. And then of course we've got Microtox, which we use a special little applicator, and we can stamp into the skin as opposed to the muscle just to relax tissue and tighten up pores. So that's a really popular area, and we've got another video on that. So that basically covers all of the popular areas for where we can place neuromodulators with associated costs as to how much they should be. Thanks so much. If you enjoyed this video or found it helpful, please hit the like button, share it with your friends, subscribe, and hit the notification bell. And don't forget to leave us comments or questions down below so we can get to know you better.